stop brushing your teeth like this before it's too late. There is something happening inside your mouth every single day that you have probably never noticed. It isn't dramatic, it doesn't hurt right away, it doesn't show up overnight. It is silent, it is progressive, and it is precisely because it is silent that it manages to advance so far before anyone finally realizes something is wrong. I started noticing this when I analyzed a pattern that kept repeating itself across dozens of different accounts. People complaining about persistent bad breath, bleeding gums when brushing, sensitivity when drinking something cold, a strange taste in their mouth right after waking up. People who seemed genuinely frustrated because they were doing everything they thought was right. They brushed their teeth every day, some of them 3 times a day. They used mouthwash. They bought expensive toothpaste covered in promises, and yet something kept getting worse. And the most shocking part? Many of those people were making things worse specifically because of the way they were brushing. The most basic hygiene habit we all learn as children was the primary driver of the problem. That hit me hard. Because most people never question how they brush their teeth. It is an automatic habit repeated mechanically for decades, without reflection, without technique, without real guidance. We just pick up the brush, put on some paste, scrub around, and assume everything is fine. But it isn't. The silent beginning of a problem you haven't noticed yet. The process rarely begins with pain, and that is precisely why it advances without resistance. The first sign tends to be subtle, a mild sensitivity when drinking cold water or biting into something very sweet. Most people ignore it or blame a specific tooth that has always been a little sensitive. Life continues normally, then comes the bleeding, a thin streak of blood while brushing. Sometimes it shows up in the toothpaste foam, sometimes you notice it in the mirror. And here, something very telling happens. Most people think bleeding is a sign that the brush is doing deep work, that it is cleaning thoroughly. Or they believe it is completely normal, that bleeding gums are just something that happens to everyone, but they aren't. Healthy gums do not bleed. When there is recurring bleeding, there's active inflammation, always. The problem is that this information never reached most people in a clear and direct way, so the bleeding gets ignored. The routine continues, then a slightly bitter taste appears in the morning, then breath that lingers even after brushing, then a gum line that starts to look different, redder, more swollen, slightly painful to the touch. And when the person finally decides something is really wrong and goes to the dentist, the discovery is alarming. The gums are inflamed, receded, and the teeth are exposed in areas that should have been protected. Sometimes there is a loss of gum tissue that cannot return without professional intervention. All of that started with a thin streak of blood that seemed harmless. The illusion of pressure. When I began studying how people actually behave while brushing, one pattern became immediately clear. Most people scrub their teeth hard, very hard. And there is a psychological reason for that. In our minds, force equals cleaning. The more pressure we apply, the more it feels like we are removing dirt. That logic works when scrubbing a pan, mopping a floor, or cleaning a heavily crusted pot. But your mouth is not a pot. The gum is living tissue, vascularized, sensitive, with a microscopic architecture that is extraordinarily delicate. It was not designed to endure daily mechanical aggression from repeated heavy pressure. What happens when you scrub your gums hard every single day? First, invisible microlesions form, tiny wounds in the surface tissue that the immune system constantly tries to repair. And that repair attempt generates local inflammation. Persistent inflammation in gum tissue creates the perfect environment for bacterial proliferation. And here is where the most dangerous cycle in oral health begins. Anaerobic bacteria, the kind that survive and multiply in low oxygen environments, exactly like inflamed gum pockets, begin colonizing the damaged areas. These bacteria produce volatile sulfur compounds Those compounds are precisely what causes the persistent bad breath that no mouthwash can truly eliminate. More inflammation means more bacteria. More bacteria means worse breath. Worse breath makes the person brush harder, trying to fix it. And harder brushing means more inflammation. The cycle closes. And the mouth gets progressively worse, while the person genuinely believes they're doing everything possible. The mistake nobody taught you to recognize. There is a movement that almost everyone makes when brushing their teeth. It is the horizontal movement. Back and forth across the teeth. Fast, with pressure, as if sanding down a surface. That movement is one of the most destructive things you can do to your oral health. Dental studies have demonstrated that repetitive horizontal movements with excessive pressure cause two types of simultaneous damage. Abrasion of the tooth enamel at the cervical region, the part closest to the gum line, and direct mechanical trauma to the gum tissue itself. Enamel does not regenerate. Once it is worn down permanently. That exposes the dentin's more porous and sensitive layer of the tooth, which is responsible for the intense sensitivity to heat, cold, and sweetness that so many people live with, as though it were a normal part of adult life. But it is not normal. In a large portion of cases, it is the direct consequence of years of brushing the wrong way. And what makes the situation particularly cruel is that the increased sensitivity causes the person to brush more carefully in that area, but usually with even more tense horizontal movements because they want to clean thoroughly the part that feels most vulnerable, more wear, more sensitivity, more trauma. The zone almost everyone ignores. There's a line inside your mouth that has probably never received adequate attention in your entire life. It is the gum line, the meeting point between the tooth and the gum. That is precisely where microscopic food remnants and bacterial plaque accumulate most intensely. It is a moist, sheltered, poorly ventilated region, perfect for microorganisms to settle and thrive. And it is exactly that region that most people skip during brushing. The reason is simple. The brush moves quickly across the visible surface of the teeth, the white part everyone wants to keep shiny, without dedicating time or attention to the line where the tooth meets the gum. When that area is not cleaned with proper technique, bacterial plaque mineralizes over time and hardens into tartar. Tartar cannot be removed by brushing. It can only be removed by a dental professional, and while it remains there, it functions as a permanent reservoir of bacteria, keeping gum inflammation chronically active. This is why so many people go in for a professional cleaning and find that a few months later the tartar is already back. It is not because the cleaning failed, it is because the daily habit continues feeding the problem at the same rate the professional tries to solve it. What dental specialists observe and rarely manage to communicate, dentists spend years studying the human mouth in its finest detail. But there is a structural problem. The average dental appointment lasts less than 30 minutes. The professional needs to examine, diagnose, treat, and still counsel the patient within that limited window. Teaching proper brushing technique in a way that truly sticks would take a kind of time that the conventional appointment rarely allows. The result is that most people leave the office with a generic recommendation like brush at least twice a day, and go home repeating exactly the same mistakes as before. What specialists in periodontal health and oral hygiene know, and what is rarely communicated clearly to the general public, is that there is an enormous difference between brushing your teeth and actually promoting oral health. Brushing your teeth is a mechanical motion that anyone performs automatically. Promoting oral health involves correct brush angle, approximately 45 degrees to the gum line, so the bristles reach the space between the tooth and the gum without traumatizing the tissue. Circular or vertical gentle motions, the clean without aggressing, that remove plaques without creating micro lesions. Minimal pressure, just the weight of the brush itself is enough for efficient cleaning when the technique is correct. adequate time per area. Each section of the mouth deserves dedicated attention, not a quick sweep. Tongue cleaning, and where a significant amount of bacteria accumulates, directly contributing to bad breath. Correct use of floss, which is not optional for anyone who wants real gum health. Daily consistency, because results only appear with correct repetition over time. None of these elements is complicated in isolation, but combined, practiced consistently, they completely transform the environment inside your mouth. What happens when the technique changes? Something very interesting occurs when a person stops aggressively attacking their gums daily and begins treating them with the right technique. Gum tissue has a remarkable capacity for recovery when its environment improves. Within a few days, bleeding during brushing starts to decrease. This happens because acute inflammation begins to subside once the constant mechanical aggression is removed. Within 1 or 2 weeks, many people already notice a difference in their breath. The bacterial balance starts restoring itself when plaque is efficiently removed from critical areas and when inflammation begins to calm. Within a few weeks, sensitivity tends to noticeably reduce, especially when the wear has not yet progressed to an irreversible stage. After months of consistent practice, the gums gradually return to a healthier appearance. Pink rather than red, firm rather than swollen, free from pain when touched. These changes are not miraculous. They are the direct consequence of removing a daily aggressive stimulus and replacing it with a habit that respects the biology of gum tissue. And most importantly, this shift does not require expensive products, sophisticated treatments, or drastic interventions. It starts with technique, with attention, with consistency. The impact that goes far beyond the mouth. It is easy to underestimate how much oral health affects quality of life, but anyone who has dealt with persistent bad breath knows exactly what we are talking about. There is a constant, exhausting self-consciousness in every conversation. You find yourself preoccupied with the distance between you and the other person. You discreetly test your own breath multiple times throughout the day. You avoid speaking close to people. You stop smiling openly. It affects relationships. It affects professional performance. It affects how you carry yourself in social situations. It affects your self-esteem in ways that are difficult to articulate clearly. And the cruelty of the situation is that many of these people are genuinely trying. They really make the effort. They buy the best products they can find. They brush multiple times a day. And they still carry this insecurity because nobody ever showed them that the problem is not in the frequency, not in the force, not in the products. It is in the technique. The mistake of treating the symptom instead of the cause. This is perhaps the most important point of everything we have covered. Most people and most oral hygiene habits taught superficially treat symptoms rather than causes. Bleeding gums? Switch to a softer brush. Bad breath? Buy stronger mouthwash. Sensitivity? Use toothpaste for sensitive teeth. Swollen gums? Wait for it to go away. These adjustments can provide temporary comfort in some cases, but they do not address the root of the problem, which is chronic inflammation being fed daily by incorrect brushing technique. As long as the cause remains active, no symptomatic solution will produce a lasting result. It is like taking fever medication without treating the infection causing the fever. The thermometer reading drops temporarily, but the infection continues progressing underneath. When a person understands the real mechanism, the chain between incorrect technique, microlesions, inflammation, bacterial proliferation, bad breath, and gum recession, they stop looking for surface-level solutions and start addressing the real problem. And that is when everything changes. Why this matters more as time passes. There is a progression that needs to be understood. In the early stages, gum disease is completely reversible. Inflamed gums respond quickly to changes in habit. The tissue recovers. The bacterial balance restores. There's no permanent damage. But as time passes and inflammation continues without correction, the process advances to more serious stages. Gingivitis, surface-level gum inflammation, can progress to periodontitis, which is the inflammation of the deeper supporting tissues of the tooth. At this stage, the alveolar bone, the bone that holds the tooth in place, begins to be progressively destroyed. Bone loss does not regenerate easily. Teeth that lose bone support become loose. Loose teeth can fall out, and there is more. Research over the past 2 decades has established connections between periodontal disease and the systemic conditions, including diabetes, cardiovascular disease, and pregnancy complications. Chronic inflammation in the mouth does not stay confined to the mouth. It has a measurable impact on the body as a whole. This is why oral health is not a matter of vanity. It is a matter of whole body health. And it all starts, or all gets worse, during those 2 to 3 minutes in front of the mirror that you repeat every day without thinking. What people who reverse these problems have in common? Looking at accounts from people who managed to significantly improve their oral health without complex dental interventions. Certain patterns repeat themselves consistently. All of them stopped treating brushing as a quick task to check off. All of them paid specific attention to the gum line, which had previously been completely ignored. All of them dramatically reduced the pressure they were applying, discovering that the brush worked better with light, deliberate movements. All of them incorporated tongue cleaning as a fixed part of their routine. All of them gave flossing the real importance it deserves, not as an optional accessory, but as an indispensable part of oral hygiene, and all of them noticed improvement far faster than they expected. Bleeding that stopped within days, breath that changed within weeks, sensitivity that progressively reduced, gums that returned to the look and feel of health. This is not coincidence. It is the body's natural response when it stops receiving a daily aggressive stimulus and begins receiving the proper care it always needed. Before you go, if you made it this far, you probably recognize something in this story. Maybe the bleeding when brushing that you consider normal. Maybe the sensitivity you have learned to live with. Maybe the breath that bothers you, but for which you have never found a satisfying answer. Maybe a gum line that looks a little different than it should. If any of those signs are present, know that you are not alone. And more importantly, know that there is an identifiable cause and a practical, accessible solution. The path to a genuinely healthy mouth rarely runs through more expensive products or more aggressive treatments. It begins with correcting those 2 or 3 daily minutes you spend in front of the mirror with a brush in your hand. Because the mouth responds, the body responds. When the environment improves, biology follows. And that, the capacity of your own body to recover once you stop getting in its way, may be one of the most liberating discoveries you will ever make about your own health. We left a practical, direct guide in the first link in the description. Click and take a look, because what is there may completely change how you care for your mouth starting today. If this content opened your eyes in any way, subscribe to the channel. In the next videos, we will keep uncovering the silent habits that are affecting your health in ways you have probably never imagined. Because the sooner you understand what is really happening, the better your chances of acting at the right moment before the damage becomes irreversible. See you in the next one.